Hello, Assalamu alaikum everyone. This is Dr. Armish here. Welcome to my YouTube channel. And in today's video tutorial, we will talk about COVID-19 diagnostics by performing a nasopharyngeal swab. So before starting, you must know that what is the specimen or what is the purpose of specimen. So a specimen is a sample of something like a sample of blood or a body tissue that is taken for the medical testing. And the purpose of testing that sample is confirmatory diagnosis of the suspect or to demonstrate the freedom from infection in a defined population or to demonstrate the eradication of disease or elimination of infection from a defined population. Now there are important measures to follow while taking the swab test sample that is essential to follow the proper measure. It is essential to follow proper measure when the sample is collected from a patient suffering with the novel coronavirus. The healthcare profession should take care of the following measures. Or you can say that these are the personal protective equipment that one must have while taking the sample. That first one is mask, which is N95, that will protect you from getting coronavirus. Then gloves, safety goggles or the safety glasses, safety gown. So the healthcare profession must have these personal equipments while taking any sample. Then moving towards the procedure of nasopharyngeal swab test. First, allow the patient to blow their nose. During sample collection process, patient must sit in a relaxed position or allow the patient to sit in a comfortable position. Then tilt the patient head back slightly and support the neck with your non-dominant hand. That may be your right hand or the left hand, depends upon a person to person. Just like this picture, the exact position should be like this. Then stand slightly offset the patient to avoid the risk of contamination in case if the patient coughs or sneezes. And be sure to advise the patient potential discomfort during sample collection and also close their eyes if possible. Then sample collection only be completed using sterile swabs made of artificial cottons with flexible plastic swabs, as you can see in the picture below. Calcium alginated swab or the swab with wooden shafts or wooden buds must not be used because the material can inactivate the viral particles or the wooden shaft can cause patient injury. So you must avoid using calcium alginated swabs and the wooden swab. Then you should take care of holding the swab position. Just hold the swab just like a pen between your thumb, index and the finger. As you can see in the picture, the position should be like this. And avoid this kind of hand position during the sample collection. Then start by inserting the swab horizontally into the left or right nostril of the patient. Carefully insert the swab by maintaining a course that is close to both septum and the floor of the nose. Then make sure to don't move the swab upward. Instead, straight back and until the resistance felt and swab reaches to the posterior nasopharynx. Just watch closely, you will get that what I am trying to say. That is, when you insert the swab, you just felt the resistance that the swab reaches to the posterior nasopharynx. And when you are collecting the sample, the distance would be approximately 5 to 6 centimeter or 2 inches. Then after that, leave the swab at this step and for few seconds while twisting the swab slowly and gently. Then remove the swab slowly and immediately insert the sample in the swab collecting tube, which may contain 2 to 3 viral transport media. After that, send the sample to the lab as quickly as possible and the result will take almost 24 hours. So this is all about the procedure of nasopharyngeal swab. If any patient suffering from novel coronavirus or COVID-19, you can use this test for diagnosing purpose and it will help you to figure out. I hope you guys like this video. If you like it, please hit the like button and subscribe my channel Stay tuned, stay safe.